Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. From Boundary to Bear Lake, Fremont to Payette, Oahe to Oneida, there are interesting people, places, and histories in all of Idaho's counties. And Idaho Matters wants to share it with you with stories from all 44 counties that make up the Gem State. Email your ideas to idahomatters@boisestate.edu or use the Talk to Us feature in our app, available on Apple and Android, and tune in each weekday at noon for Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. The Department of Health and Human Services is pulling $500 million in funding from 22 mRNA vaccine projects that target COVID-19, the flu, and other respiratory viruses. Health Secretary Robert F. Kennedy Jr., who is a vocal vaccine critic, announced those cuts yesterday. This will impact major pharmaceutical companies like Pfizer and Moderna. So, what does this mean for the future of vaccine development? Dr. David Pate, who is the former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, how significant is this decision for the future of vaccine technology, in particular mRNA vaccine technology?
Well, this is huge, and it is a really foolish decision, and here is why. The reason that the United States government was prepared to roll out a vaccine against SARS-CoV-2 in record time was that it was recognized before the pandemic and before all the people started coming out with the anti-vaccine stuff about this vaccine, that the best way for the United States to prepare itself, the most promising technology, because it could speed up the process considerably, was mRNA vaccines. And so that was what prepared us. Now, since those mRNA vaccines have come out, and because this was a pandemic, and because it affected the entire world, and we did hundreds of millions of doses of vaccine, we actually have more data on this vaccine than most vaccines. And in fact, it is extremely, in quotation marks, safe. And I put it in quotation marks because when I say if it's safe, then somebody say, oh, but I know somebody got harmed. Look, you need to understand what safe means. Safe doesn't mean that some people don't have harms. It doesn't mean that people don't have reactions. What it means is that when you look at the threat of the disease and what it will cause, is the vaccine causing far less problems in a far less number of people. And that is true. And so it has saved hundreds of millions of lives, and we know it's both effective and safe. Now, COVID carries with it a lot of baggage, so let's step away from COVID. The thing about mRNA vaccines is two things that I think we're being foolish about. Number one, we will have another pandemic. Mark my words. We will have. I can't tell you when it's going to be, but I certainly would not be surprised to have another pandemic within a decade if you just look at the history of how they've happened. Now, COVID was bad, but there are many potential pandemic threats that could be far worse. And we're talking about kids being deathly ill or kids dying and young people dying. And so what we've done is we have just cut our nose off to spite our face because, oh, those bad mRNA vaccines. Well, now
Hmm.
we could be in a situation where people will be clamoring for them and we're going to be at a big disadvantage. And then the second thing is, and I think you and I talked about it last week, we're now seeing the potential for mRNA vaccines to actually prevent cancer, and we're stopping
Right.
that right in its tracks.
So, Dr. Pate, I'm thinking of, I mean, not just the impact this will have on public health efforts to fight COVID-19, and but I mean the flu, but also what about, and you mentioned this, but emerging viruses. I mean, you and I have talked about H5N1.
You have hit the nail on the head. And that is to say that, we have, you and I have talked for 2 years about
Hmm.
all the changes that have been happening with that H5N1, the avian influenza, and how I can't tell you whether that's going to create a pandemic, but we have talked about all the steps along the way that if you were writing the script for this to become a movie about how H5N1 becomes a pandemic, this is how it would look. And so we are crippling ourselves. And what it just means is that we will incur months delay in getting out a vaccine if that happens, but other potential threats as well. So you're exactly right, Gemma.
So, Dr. Pate, I mean, as you mentioned, mRNA vaccines were credited with helping end the worst of the COVID-19 pandemic. And let's be very clear, President Trump was in office during COVID-19. In fact, we need to give credit where credit is due. He sped up the all of the research on mRNA vaccines. He sped up in Operation Warp Speed to get mRNA vaccines out to people so that the pandemic would slow down. So why in the world, in your opinion, would the government now be backing away from this technology?
Well, I think because it's been politicized. You're right. I have praised the Trump administration for Operation Warp Speed. That was a huge accomplishment, and they deserve a lot of credit for that. They saved a lot of lives. But the problem is, it's become politicized, and unfortunately, my party, the Republicans, have decided that vaccines are bad and COVID vaccines are the worst. And because of that, President Trump can't even take credit for it because it so turns off the base. And right now, what seems to be the case in politicians, from my observation, my opinion is that most all of the decisions being made seem to be what's going to make the base happy, not what's going to protect America or serve all Americans the best. And so it's a huge problem now that it's been politicized.
And I want to make a point here, Dr. Pate. I have a friend who sent a text to a group text I'm in just this morning and saying that she's in a vaccine trial right now. And she went in for a checkup today. And the doctor told her they lost funding in this $500 million cut. So she was told she's far enough along in the process that she can continue. However, this vaccine trial cannot take any new participants because they've lost funding. So I bring this up because I think it's important that people understand the real world impact of what's going on with the loss of this funding. And to also say that I know I went down the rabbit hole. I read a lot of comments through national and local, what people had to say about this. And a lot of people are like, good, it's big pharma. Let them pay for it, right? We shouldn't have to let big pharma take this over. I'm curious about your thoughts on this as well, but also the fact that vaccine trials can now only go so far.
Well, let's start with the last part of it. The reason that the NIH funds so much research is because Big Pharma won't. I think people have been throwing around this term, Big Pharma, as something bad. And look, I'm not an apologist for the pharmaceutical industry. There's lots of things about the pharmaceutical industry that irritate me as a healthcare professional. But let me tell you, if you have cancer and you need chemotherapy, you're getting it from quote unquote big pharma. If you have high blood pressure and you have it under control so that you can avoid having a stroke, that's coming from big pharma. So we just need to put things in perspective. And the thing is, people seem to think that vaccines are this tremendously enriching product line for pharmaceutical companies. They would rather make almost anything other than vaccines. Vaccines are not particularly profitable, and so that's a problem. Now, to the bigger point that you mentioned, the kind of the collateral damage from not funding this research. Remember that when we do this research, not only are we learning about mRNA vaccines, we are learning
Hmm.
so much more. What we have learned from this pandemic is extraordinary because we've had the opportunity for this international research. So we're learning more about what's called mucosal immunity, which we have known almost nothing. And I hardly got taught anything in medical school about it because we just didn't know much about it. But how can we create a immune response in your nasal passages, in your throat, which is different than other types of immune responses, so that we could actually prevent you from getting infected, let alone getting severely sick and dying. We've learned so much about mucosal immunity. We're learning more about even things like frequency. How soon should you get your next dose of vaccine? And what we realized is that initial recommendation for 2 months was problematic, particularly for young males and getting myocarditis. If we spread that out, we significantly decrease that risk. We are learning things about how the immune response to this virus occurs, what we can do to alter that response. So there's so many things that we learn that it's not just mRNA. It means that we're not going to learn a lot of stuff that would be helpful, even if we used a different platform and with a different virus.
So, Dr. Pate, for patients who rely on new and updated vaccines every year, um, how concerned should they be about access or, frankly, effectiveness moving forward?
Well, this is very concerning. No one that knows me would suggest that I'm a conspiracy theorist. I have operated very much in the objective world and tried to focus on data, but I cannot avoid coming to the conclusion when you look at the actions taken in their totality so far that it's not just new vaccines that are going to be threatened. I am certainly seeing the pieces fall in place as to how this is an attack on even vaccines we haven't discussed yet that are currently approved. And if you follow this closely, you can certainly see the clues and signs that they are not going to rest with just impeding the development of mRNA vaccines. They've got a much broader scope. I think that explains why the new ACIP, that Advisory Committee on Immunization Practices, why those previous experts were summarily dismissed. And now we've got 8 people who are not the people that any serious person would appoint. We've You can listen to RFK Jr.'s other comments about other vaccines. And I think this is going to be a huge threat. And I think there is a much bigger picture still that hasn't fully emerged, but it is very concerning.
Uh, So, Dr. Pate, with all of that said, I mean, I sit here and I think sometimes, I know you and I have touched on this before, it's almost as if vaccines did too good of a job. And what I mean by that is that it eradicated diseases, right? Or made them so that people didn't get horribly sick. Then we had COVID. And all of a sudden, we saw what a virus could do. So, how much do you think that also plays into it? And this idea that we as a culture became very complacent to this idea that vaccines really are effective and there is a need for them. I mean, I certainly don't want to go back to a time in public health 100 years ago, but there are days where it feels like, are we heading that way?
Well, yes, and to your point, 100 years ago, before these vaccines, um, it was not uncommon to have children die in their first year of life from what are now preventable vaccine diseases. Um, if you and I think you're exactly right. There's several factors that are contributing to this. One is, you're right, our complacency, the fact that people have not, people alive today, especially people younger than me, which is probably most everybody listening, they've not seen a case of polio with the person in an iron lung. They have not seen a case of measles in the hospital with measles pneumonia. They have not seen a person with tetanus who is contorted in such a terrible way that it makes you hurt just looking at the person with the spasms of their muscles and all. They have not seen a child with diphtheria with a thick gray membrane in the back of their throat that is actually obstructing their ability to swallow and breathe. Horrifying things, because many of those people didn't survive. The people that survived had mild cases, and so they think the disease is mild when that's not how it worked. And of course, that leads to the next point. When you look at social media and what has happened, as people have tried to fight the vaccines, they kept on trying to send a message that COVID is mild. COVID is just like having the flu, or COVID is just like a cold, and so forth. And if you were at home and during that early part of the pandemic, and not in the hospital, not seeing patients on ventilators, not seeing those patients in the emergency room who couldn't breathe and who were asking, "Oh, is it too late to get the vaccine now that this person's dying?" You could fall for that story that it's mild because you just haven't seen it. But we saw it, and it's in the numbers. And then social media, because it has created such emotional and vigorous responses, the platforms amplified those messages. And so we've been at a real disadvantage of trying to fight this and help people to understand just how bad this can be, because we couldn't even let family members in the hospital to be with these patients, let alone the public. And so people haven't necessarily seen this, but it's just because you haven't seen it doesn't mean it's not out there.
Dr. Pate, the measles has been detected in wastewater in Coeur d'Alene. However, still no official reported cases here in Idaho. What does this tell us about this report that came out? Because it said it's a very serious case that was detected in the wastewater.
Yeah, so the detection of the measles virus in the wastewater in Coeur d'Alene tells us that there was one or more people in that area that is served by that wastewater that had measles. And that was detected on July 29th, as I recall. And of course, that's not surprising to you or I, as we've discussed before. that with
Mm.
this growing measles epidemic, that it would not be surprising. In fact, it would be surprising if it did not end up coming to Idaho. It's just a matter of time. And of course, we've got Canada to the north that's having a worse measles outbreak than we are. We've got Oregon, Montana, Washington. We've got other states that have the measles cases. So the question is, was it somebody that lives in Coeur d'Alene or was it someone passing through? The only kind of extra insight into answering that question is that we saw the levels of measles virus increase 2 days later. Uh,
Mm.
that is too soon for a brand new case to have transmitted to somebody else. So it suggests to me that either it was people exposed a couple of weeks prior, and now we're starting to see the very early part of an outbreak locally, or it means probably there were others traveling with this person, and maybe they were staying there for a little bit, and now some other people, probably in that family, have come down with measles. The only way we're going to know is to watch and see does that, because that level tripled in those 2 days, and we just need to
Mhm.
look and see if it goes right back down. Good chance it was somebody passing through, just staying for a couple days. If it continues to go up, then we're probably going to see an outbreak.
So, what should folks do, Dr. Pate, if they're living in that area? Because I believe health officials up in North Idaho did say you should get your you should get your vaccine status checked.
Yeah, that's the very most important thing is that if you don't think you've been vaccinated, or if you have children that you know haven't been vaccinated, is get vaccinated. If you are an adult with questions about that, you can talk to your doctor. Your doctor may have records, may have access to the records, or you can you can have a discussion about whether to check your antibodies levels or just to go ahead and give you the vaccine because unless you're pregnant, it's a pretty easy and safe way to just go ahead and do it and be sure. The people that really should be worried up there is those mothers with children that are too young to have been vaccinated yet. You do not want your infant getting measles. And so, either if you are able to take precautions to keep your infant away from others, then obviously that's one approach until they are able to be vaccinated. But if you know that, for example, your child is in daycare or as other things, church, others that is going to be exposed, that'd be a really good time to now go ahead and talk to your pediatrician or family physician and discuss should your child be vaccinated early? What measures should you take?
And Dr. Pate, on top of this, here in Ada County, the first West Nile case of the season has been found. So remind us what West Nile is.
So, West Nile virus is in a family of viruses we call the flaviviruses. It's and in broader terms, we call it an arbovirus because arboviruses are transmitted by fleas, ticks, or mosquitoes. In the case of West Nile virus, it's transmitted by the Culex mosquito. So, we typically see West Nile show up in mosquitoes in the summer. So, this is not shocking, but we do know it is now in our area. There's been two separate detections locally, one in Boise, one in Star. So we know it's there. And how we know that is that they sample mosquitoes, test them to see if they have the virus. So this is not a virus in a person yet. This is viruses in the mosquitoes, but that's the
Mm.
next step is the mosquitoes will feed on humans, and then if they have the virus, then they can transmit the virus to the humans. So what would happen if you got bit by a mosquito that was infected and then you got West Nile? Well, a large percent of people, about 80%, will actually not have any symptoms. So you may not know it. However,
Hmm.
about 20% do get sick from this, and it's typically fever, headache, feeling very fatigued, and perhaps a quarter to a half of those people might get a rash. The worrisome thing that why we worry about West Nile virus is that because that 20% will get better and the 80% doesn't even know they have it, but about 1% of people will get severely and potentially life threateningly ill with what we call neuroinvasive disease. And that means they can get meningitis or encephalitis or rarely something we call acute flaccid paralysis. What this means is either an inflammation of the brain or an inflammation around the brain is how we distinguish these. But those people are going to be very ill, and they certainly may be talking out of their head. They will have high fever. They could be
Mm-hmm.
complaining about their vision, stiff neck, those kind of things. The point is, if you have those symptoms, you need medical attention. The big thing is what to do to prevent it. Make sure you don't have standing water on your property because that will attract the mosquitoes. And these Culex mosquitoes typically feed in the early morning hours and the late morning hours. So if you have to be out early or have to be out late, where you could wear long sleeves, have pants on rather than shorts, or if it's too hot, then spray with a DEET containing insect repellent. Make sure you've got your windows, your house closed, or if you have screens, make sure your screens are intact. Keep the door closed so the mosquitoes aren't flying in and out. Take those kinds of precautions to avoid getting bitten by the mosquitoes, and then they'll be gone by the time we get our first frost.
All right. Well, appreciate all of this information, Dr. Pate. We, of course, have been speaking with Dr. David Pate, former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have a public health question for Dr. Pate, you can send us an email, idahomatters@boisestate.edu. I'm Gemma Gaudette, and this is Idaho Matters.